Hi, I'm Stephanie Hessel. I'm the Neurologic Residency Program Director, and I also serve as the Rehab Services Manager for satellite clinics. Our residents start at Bentab, which is our level 1 trauma center in the Med Center. Then from there, they'll go to the inpatient VA spinal cord injury unit. And then after that, they'll come to Fornes Place Outpatient Rehab, where they work with patients with different diagnoses, everything from stroke, traumatic brain injury, spinal cord injury, Guillain-Barré, ALS, amputees, and a multitude of other neurologic diagnoses. They also have their year-long capstone and research project and participate in the IPE experience with Baylor College of Medicine 3rd and 4th year medical students.
Hi, my name is Robbie Cruz, and I'm a neurologic physical therapy resident here within Harris Health. A typical day for a neurological physical therapy resident involves evaluations, treatments, and reassessments for individuals with neurological disorders. Typically, we see patients post-stroke, post-spinal cord injury, as well as brain injuries. My expectations for mentorship have been met and even exceeded. Mentorship typically looks like about 4 hours a week where you get one-to-one mentorship on difficult patient cases where they guide you and provide you with their clinical pearls and expertise to help advance that patient's particular plan of care. And then there are also opportunities to have indirect mentorship where you can just come to your mentor, let them know what you're struggling with, and they can have a conversation with you so that they can kind of help fill in the gaps. But mentorship in general is a great experience. I feel incredibly supported by my mentors and the staff in general. I never feel like I'm on my own free floating. I always feel that I have at least a hand to hold and anyone to provide me with advice if I need it.
We've had more than 20 graduates since we've started in 2011, and I keep in touch with the majority of those residency grads. Some have stayed here at Harris Health, and some have gone on to do things across the country. Some of that includes being manager, a director, submitting abstracts, poster presentations, presenting at national conferences. One has went to law school to pursue healthcare policy administration, and then also written self-care books, started their own businesses, a multitude of different career opportunities that residency set them up to do well with.